Well, Dr. Rhet Smith is a professor at the University of Arkansas at Little Rock, and he's done a lot of research on medical marijuana. It's interesting how he came to approach the subject from an economic and a criminal justice perspective. I sat down with him recently for a conversation. You have been doing some significant economic research in the field of medical marijuana, which is still a fledgling field of business in Arkansas. Tell me a little bit about what your research has been and what got you started in this.
So I think what actually got me started in this was my upbringing with my father in law enforcement and my mother, an emergency room nurse. I think those backgrounds really sort of guided my interests. And so then when I started to go to school for economics, my interests actually were in the economics of crime. And after taking some health courses, I wanted to understand more so the aspects of substance abuse. And I started looking at things like cannabis, and questions like, is cannabis a gateway drug, was very prevalent with growing up. And so trying to understand that relationship of cannabis to other drugs really drove a lot of my research. And so a lot of my research focuses on those actual dispensaries, those businesses, what type of effects they have on the surrounding communities.
So can you answer that question if it's a gateway drug, or do you just have research about that?
I think it depends. So my initial research paper was looking at the effects of these cannabis dispensaries on opioid-related overdoses. So to see what effect that had on our ongoing opioid epidemic. And early results were showing that in areas where these dispensaries were opening up, we had these relative declines in opioid-related deaths. And so that would actually go against this idea of it being a gateway drug. Now, I think the relationship is a little bit more nuanced than that, as there's different types of opioids, and those relationships are going to differ across those different types of opioids, as well as across different demographic groups, or even urban versus rural locations as well.
So we have seen in Arkansas, I believe that medical marijuana sales has surpassed $400 million since these dispensaries have started opening, which is generating some significant tax revenue at this point in time, and I expect it will get larger. What are you seeing in terms of the economic activity of medical marijuana cultivators as well as the dispensaries? Is there any data that's kind of showing you anything beyond just those sales tax figures?
It depends on a state by state basis, actually, as legalization has gone through too. Each market is going to be different. What type of information they release to the public is also going to be different. But yes, you're exactly right that this market is very large, and the legal market continues to grow. We're actually having a discussion about this market here in Arkansas, which is fairly restrictive and stringent, relatively speaking, versus say like our neighbor in Oklahoma, where there was a lot more, I guess, more liberal in that case, where it was easier for dispensaries to open and more licenses were given out essentially.
Yeah, they didn't they didn't really put any limitations on anything over there versus the really strict guidelines that were here in Arkansas.
Mhm.
Let's talk a little bit about how medical marijuana is being marketed in Arkansas in particular. Maybe you compare it to some other states, but what are we seeing? I know in like say the pharmaceutical industry, you have sales reps that go call on doctors, and that's how it kind of goes. This seems to be more of a business to consumer model, but you still need that physician approval. So kind of how's it kind of playing out compared to what we've traditionally seen?
No, so yeah, you're exactly right. So actually, we just have a recent research paper that sort of gets at that relationship, where traditional pharmaceutical companies send out their reps to doctors to talk about the effectiveness of their product, what it's good at treating its uses essentially, and and cannabis doesn't have that. And so we were trying to understand what is actually going on here, and you're exactly right that a lot of the cannabis seems to be more patient driven, where the patients will seek out doctors that are more willing to write these cannabis recommendations. And they're actually more proactive in trying to get that as a treatment for whatever ailments are trying to alleviate, I guess.
It's interesting. So I guess last question on this subject here, where do you kind of see things going maybe in the next wave of medical cannabis in Arkansas? We've got a limitation on dispensaries. We've got a limitation on cultivators. Is it going to get to a point where we have to expand that because of demand, or do you think that we're still pretty much in those parameters right now of being able to provide or meet the needs that are out there?
That is a good question. I think the market is going to continue to expand. And I think those providers are going to continue to branch out to areas where there's demand, but maybe not the competition there. I think that's just natural business behavior. So I think that is going to continue, obviously contingent on the regulations that allow those licenses to be to occur. But I think the general process is going to follow what a lot of states have been doing, where we get this push for the medical cannabis legalization, understand what the effects may be, and then you start to see even more push for more lax regulations, I think.
I guess we could also see it's talked about, I don't know if it'll be on the ballot or not, there'll be a push for it to just legalize marijuana altogether. You've also got potential federal action to decriminalize marijuana. Those would be big game changers to the medical cannabis community, wouldn't they?
Yes, you're exactly right. I think the adult use, I've seen the petitions around, I suppose, and so I don't know if that is going to get on the ballot or not. It will eventually, but yes, I think the federal laws are seen. I think we're at 37 states that have now legalized medical cannabis. So a majority of the states and a majority of the citizens are subject to these laws, and so I think it's only a matter of time before federal law starts to catch up with the state laws.
All right. Anything else that you wanted to add that maybe I didn't get to ask you the smart pointed question on?
For cannabis related or just research in general?
Well, cannabis related, and it can be related to your research.
So I think in general, I think the motivation for my research is usually because of this topic being so controversial. There's a lot of anecdotes and a lot of emotion behind it. And so they point to, or detractors point to, these are going to be the effects on the community. And so that's a really big motivation. So looking at things like the gateway theory, or my next round of research is looking at criminal behavior. Do these businesses attract crime, or is there this deterrence effect? So a lot of that sort of motivates where my research goes, to be able to actually provide, this is what the data is telling us, a little bit more than what the anecdotes may provide. So